Good morning and welcome back to this morning's second plenary session on health, education, and human development. My name is Christopher Chyba, and I'm co-director of the Center for International Security and Cooperation, CSAC, in the Institute for International Studies here at Stanford. CSAC pursues policy-relevant research, education, and Track 2 diplomacy in a variety of key post-Cold War international security areas, including bioterrorism and emerging diseases, nuclear nonproliferation, ethnic conflict, and peacekeeping. But any view of international security that doesn't consider health, education, and human development is simply myopic. So I'm especially pleased to be moderating this session this morning. One brief announcement before we begin. The next plenary, Science, Technology, the Environment, and Development, will begin immediately upon the conclusion of this session, so please keep your seats after this session is over. As we were reminded in our first session this morning, health and education are decisive factors in eradicating poverty and advancing human development. Indeed, the world's development agenda today is in great peril because of the HIV/AIDS epidemic. As part of a global effort to combat AIDS, the Ad Council, in partnership with Tim Wirth and the United Nations Foundation, produced a series of public service announcements to help Americans become aware of the devastating effects of the disease and what we can all do to help it spread. So before we begin this panel, we'll take just a minute to watch the public service announcement, "Apathy is Lethal." Our panel this morning consists of three people: Ms. Maya Ajmera, Dr. Eric Goosby, and Ms. Betty Makoni, each of whom has been in the forefront of the fight to bring health and education to people all over the world. Our first speaker is Maya Ajmera, founder and president of the Global Fund for Children, and I ask you to please join me in welcoming Maya Ajmera.
It is truly an honor and pleasure to be here today. I've been given the daunting task of talking about health, education, and human development within the context of children around the world in 10 minutes. So I'm going to do my best. With three topics to cover, I know I could address each as a separate element, but the three are so tightly connected that in my talk, as in the programs that tackle these issues effectively, they need to be addressed as a whole. Education is a child's right, enshrined in the UN Convention on the Rights of the Child. Yet 1 in 5 children around the world, nearly 125 million children worldwide, are not enrolled in primary school. Even where schools exist, too often teachers fail to show up for class, books and learning materials are scarce, classes are crowded, schools are unsafe, and communities have little say in what schools teach. In addition, in many countries where schools are nominally free, user fees and other costs, such as those for books and uniforms, are higher than families can afford. For millions of children, the choice appears to be work and eat, or study and starve. Ultimately, even the best efforts to educate children will fail if these young people are too hungry, too sick, too poor, and too desperate to learn. The majority of child deaths in the developing world are easily preventable and due to just 5 maladies: pneumonia, diarrhea, malaria, malnutrition, and measles. Further, it is estimated that in very poor countries, children may be ill for 30 to 50% of their young lives. Health is defined generally as freedom from physical disease or pain. Yet truly healthy children are not just children free of illness. They are also free of hunger, poverty, exhaustion, stress, and overwhelming responsibilities. Incorporating a focus on human development is critical to creating education programs that truly meet the needs of children and their communities. Programs that integrate basic education with the teaching of life skills have the best chance at giving children the knowledge and skills they need to succeed. When I talk about life skills, I'm talking about the instruction in basic areas that can have an extraordinary impact on the children's daily lives. Things like reproductive health and personal hygiene, relevant vocational skills, and how to access resources that might help provide food, clothing, shelter, health care, and safety. In my opinion, there are basically 4 types of educational systems in place in developing countries. The first type of system is formal schools run by the government. These schools offer a critical educational opportunity to some students, but are failing to meet the needs of many others around the world. In fact, these schools are crumbling. The formal system presents prospective students with obstacles such as prohibitive fees, inconvenient locations, rigid schedules and curriculums, and a failure to address issues of health and development. In the second system, non-governmental organizations, or NGOs, support the formal government-run schools in a variety of ways. Increasing debt in many developing countries has caused governments to make severe cutbacks, and social programs such as education and health are often the first to be reduced. The Campaign for Female Education, or CAMFED, a grantee partner of the Global Fund for Children, has stepped in to help girl students in their final 2 years of primary school in Ghana. CAMFED students receive 2 school uniforms and a pair of shoes, as well as books and stationery. CAMFED, drawing on research showing that social support plays a role in keeping girls in schools, and makes a point of visiting the girls regularly and encouraging them to stay in school. The cost of this program is minimal. Just $66 funds each girl for 2 years. In the third system, NGOs operate or support non-formal schools. These schools are often located closer to the children they teach, enjoy a high degree of community support and involvement, and are generally more cost-effective than formal institutions. Successful non-formal education includes a focus on bringing school to the students and on structuring a schedule and a curriculum that teaches life skills as well as academics. The Chyba Social Service Organization, another partner of the Global Fund for Children, operates trained platform schools in India. Chyba works to bring schools to children. In the platform schools, children not only learn how to read and write using textbooks Chyba has produced, but they also learn a range of other skills from basic hygiene to human rights awareness. Chyba operates more than a dozen railway platform schools with an annual budget of just $8,000, serving over 300 children. And its success has inspired other educators to start schools at railway stations in other parts of India. In the fourth system, governments are supporting non-formal education programs in a variety of ways. In some countries, the government provides modest support for non-formal schools by providing land, supplies, teachers, or money for teacher salaries. In others, governments are adopting successful non-formal programs and scaling them to become part of their formal systems. Just last month, the government of Ethiopia took a pioneering step by adopting the non-formal education program developed in that country by the Save the Children Alliance. The newly adopted alternative route to basic education is designed to give children access to non-formal education through the formal education system. The program is designed to be flexible, cost-effective, and learner-centered, but also related to the daily lives of the children. By linking formal and non-formal systems, the government hopes to provide education to those the formal system has failed to reach, such as children in remote rural areas, street children, and children with disabilities. No single group, governmental or NGO, can do it alone. The number of groups tackling this challenge around the world is immense, and together they have the potential to transform the lives of the world's children. Through our work at the Global Fund for Children, we have worked closely with a portion of this vast network. In keeping with my limited time, I have boiled volumes of knowledge from our experience down into 4 basic lessons learned. Number 1, no education system can succeed without attending to the health and well-being of its students. Children cannot get to school nor learn when they are there if they are sick, exhausted, and hungry. Our grassroots partners are calling increasingly for additional resources to address not only the education and welfare needs of their young charges, but their health needs as well. Based on what we have learned from our partners, GFC now provides an annual health and well-being grant of $1,000 to each of our partners to address the most pressing health needs of the children they serve. While the uses of these grants have been varied, some examples include creating a a health and well-being packet that includes soap, toothpaste, toothbrushes, detergent, hair oil, combs, and undergarments, providing Hep A and Hep B vaccinations, iron supplements, and oral rehydration supplements, or hiring a counselor for sexually abused children. Number 2, effective non-formal education programs have several elements in common. Successful non-formal schools often adapt to the needs of their students by being flexible and creative in their schedules, locations, and curriculums. Without large capital expenses, they are generally much more cost-effective than formal schools. They emphasize appropriate training for teachers, and they often increase both the influence and the accountability of their teachers by recruiting them from within the communities where they will teach. Unfortunately, most non-formal schools around the world also have in common lack of connection to philanthropic networks. Number 3, we cannot ignore the educational, health, and developmental needs of boys. At-risk boys and young men in many countries, especially developing countries, are in crisis, a fact that has very real, current, and future ramifications for economic advancement, global security, and social progress. An increased awareness of the educational needs of girls around the world has resulted in significant efforts in this area, and a focus on the needs of boys should in no way detract from these advances. However, much less attention has been focused on the world's boys who are deprived of educational opportunities. At the very least, these boys and young men trapped by dire circumstances become disillusioned, hopeless, and angry, making them vulnerable to negative forces such as extremism, sexism, and intolerance. Although a variety of strategies must be employed to help these boys, improving their educational opportunities must include not only academic training, but also life skills and the promotion of tolerance and inclusion. And number 4, and lastly, education organizations around the world need a commitment of long-term support. While the task of providing the services I've been talking about may seem daunting, there are many small indigenous organizations that have found creative and successful ways of bringing them to their communities. Most often, these groups recognize the ties between education, health, and human development. These groups are generally underfunded and underappreciated, but they have the tools and the capacity to truly transform children's lives. Such transformations don't happen overnight. These organizations need stable, long-term partnerships and support to continue their work and to build their own organizational capacity. Without the resources to continually build on their successes, learn from their challenges, and provide the continuity children need, the potential of these innovative groups is wasted, along with that of so many of the children they seek to teach. In closing, in a village in northeastern India, 15-year-old Meena Naskar has felt firsthand the difference getting an education in both academics and life skills can make. She says, "Before, my life was like that of a caged bird that always fidgets in the cage thinking about getting out and flying." Now Meena participates in a program in West Bengal, India, called Nishta. In addition to studying, Meena and her peers contribute to their community by repairing roads and other public structures, and by using what they have learned in school to counsel families about the dangers of early marriages and pregnancy for young girls, intervene in situations of spousal or child abuse, and encourage their elders to exercise proper sanitation habits. Nishta has helped Meena and other girls of her village earn a stronger voice in the daily workings of their community, and to achieve a self-confidence that will continue to serve them well in the future. Nishta is just one example of a program making a difference in the life of one girl and her community. There are many, many programs educating and inspiring children around the world. The directors of 3 such programs, Children's Town in Zambia and Prerna and Ruchika in India, are here today. I really, really encourage you to seek them out and listen to their stories. Thanks so much.
Our second speaker this morning is Dr. Eric Goosby, Chief Executive Officer of the Pangaea Global AIDS Foundation. Please join me in welcoming Dr. Eric Goosby.
Well, thank you very much. It's really an honor to have an opportunity to speak to you today. I know that I'd say probably all of you have heard the story about HIV over and over again. And I don't mean to preach to those who have already engaged on many levels within your own organizations as well as individuals. But I'm going to just briefly look at the pandemic, its impact on the planet, and then look at some of the barriers that really have been presented to us, for those of us who are doing work in this area, to engage in substantive development of medical delivery systems to respond to the medical needs of those who are already infected and to bring them into a continuum of care, wrap around prevention and support services around them, engage with the community to sustain them, and to move a situation that really presented a dire picture into one that is moving through its burden and has sustained and created a new vision of hope. We have had a 23-year tussle with this epidemic. It began in the late 70s in the sub-Saharan African region and has taken or involved about 62 million people on the planet, either with HIV resulting in death or who currently at 42 million are living with HIV. Out of those 42 million living with HIV and the 24+ million who have already succumbed to the infection, 19 million of those individuals succumbed to the infection in sub-Saharan Africa. The relative disproportionate burden on HIV on this planet is an extraordinary one. The United States has had 900,000 individuals who are currently living with HIV. Of those, about a third of them know they're positive and have entered and been retained in care. About a third know they're positive and have not been retained in care. And a third don't know they're HIV positive, nor have they entered a medical delivery system. We spend $1.8 billion on the medical care for these 900,000 individuals in our country. The Ryan White Care Act is $1.8 billion. Those services focus on delivering medical care in the form of treatment of opportunistic infections, sexually transmitted diseases, but the vast majority of the dollars go to antiretroviral medications in the form of the heart therapy that you've all heard of. Half of those 900,000 individuals have private insurance, are paid for out of the federal or indigent pay that the Ryan White Care Act was focused on. I give you these statistics to show or to reflect on the extraordinary amount of resources going to those in the developed world, and I use the United States as an example, compared to the 200 to 300 million that the United States has put into care for HIV-infected individuals. 97% of those dollars have been on the prevention end of the continuum in the international arena. People continually have a misconception about the amount of money the United States has put into international AIDS care, and highlights, as the speakers in the first plenary alluded to, the truly extraordinary leadership that President Bush has put forward by putting a $15 billion package over a 5-year period on the table, that 55% of which will be focused on treatment. I want to turn to the barriers that we see. I think the barriers can be really summed as different variations on a hesitation to engage. The perseveration and appropriate focus on prevention interventions in the developing world for the last 23 years is something that I think we as a community in one of the richest countries on the planet have to look at. There's no question that prevention efforts are needed and effective, and in my opinion, and I think in the opinion of many of those who are in the field, when matched or partnered with treatment efforts, potentiate, synergize. But there's also no question to me that the prevention-treatment continuum and the misunderstandings around the utility of that prevention-treatment continuum have really been a barrier for those with large pots of money to feel that they are responsibly using those dollars to impact populations and individuals when they go into the treatment arena. The fear that putting dollars into the buying of medications is a black hole of sorts that results in very little utility for the individual, the community, the society that they're in. Well, I bring this forward to really encourage an open discussion around those concerns. It is my contention, and I think in our work in Rwanda and South Africa, we have seen the utility of partnering a treatment intervention that is focused on the development of a continuum of medical care and services for a specific population in a specific neighborhood with a specific constellation of clinics relating to a district hospital and a reference hospital, focusing on developing that continuum of care and services from the individual counseling and testing effort, referral into care and treatment, training and supporting and mentoring the healthcare professional, doctor or nurse provider, to play that role after we have gone in, given our didactic lectures, and exited, is really a fertile ground for laying on top of that an effective prevention intervention. Targeting your already infected HIV-positive individuals in a community for treatment, embracing them in care and services, and then on top of that adding a prevention capability has shown an increase in counseling and testing individuals who present themselves for testing to the VCT sites, as well as, we hope, over the next year and a half or so, to demonstrate an impact on transmission and hopefully a drop in seroprevalence. So the fear of engaging around the black hole of pharmaceutical medications and the cost that they afford, I think has made many individuals in the philanthropic arena to hesitate before they engage. Fear of no medical infrastructure is, I think, the second issue. The fear that there is no place for us to throw money. When we developed the Ryan White Act in the United States, we had that same problem in minority populations, African American and Hispanic communities in our country, where just the availability of dollars thrown into a community, there had to be places for those dollars to land, community-based organizations, to allow for a system of care to be supported, created, or amplified. This same issue with our, within the developing world, sub-Saharan Africa in particular, has shown that you can always find, even in very resource-poor settings, in urban settings, a constellation of NGOs and public and private partnerships that you can create a web of service capabilities that do indeed surround and support an HIV-positive population. Using those already existing medical infrastructures really is the more durable intervention, as opposed to coming in and creating a new capability by building a building or dropping in European or North American expatriate physicians and nurses to carry the workload. Training those who are already there, increasing their capability, and increasing their comfort is really the answer. Training and supporting that training, not just as I alluded to with a didactic lecture, but developing systems that allow for referral and consultation for those individuals that are now expanding their service capability is the critical ingredient. Mentoring them over time, creating those referral and consultation relationships in country, having a warm line or hotline capability for clinicians with immediate, urgent, emergent questions to be able to get them answered. All very low cost, all very efficient, all very transparent, and afford themselves to monitoring and evaluation. I finally want to say that looking at the issues around HIV and looking at how they impact the individual, how that individual is relating to a constellation of people around them, their family, how the loss of that individual reverberates through the family, through the neighborhood, through the community, is an extraordinary exercise, one that I think many of you probably have had personal interfaces with people either in the workplace or in your own families that have been burdened and impacted by HIV or another catastrophic illness. I would say that the idea of hope that one affords by entering a community through the conduit of treatment is also one of the most effective levers we have against destigmatizing. The fear of revealing oneself to family, friends, and community around their HIV positivity holds individuals, even when treatment is available, away from entering and being embraced in a continuum of care and services. Focusing on treatment, using that as the conduit through which you enter a community, support with local NGOs, wraparound services in the community again, hopefully developing a cadre of HIV-positive people in treatment who do support that system as well, does create that focal core of hope that I believe drives the stigma down and I think affords real opportunity and allows that feeling of hope in an individual family unit to permeate throughout the larger community. Thank you very much.
Thank you, Eric. And now our final panelist in this plenary is Betty Makoni, Director of the Girl Child Network, who's come all the way from Zimbabwe to be with us this morning. Please join me in welcoming Betty Makoni.
My story is going to start with the naming of children. In Shona, Tawanda means we are happy, we are many. That's a boy's name. In Shona again, Tambudzai, Tambudzikai means you are going to be poor, you are in poverty, we are said. That's a girl's name. And even with the latest translations, we have made our names into English. We have given them names for boys like talent. It means he has got it all. Silence, the girl you are supposed to keep quiet. We are not trying to confront any extraordinary issues here. Issues in the home, issues in the community, issues in the school. I come from Zimbabwe. To be realistic, but not sounding very strange, our situation is a little bit chaotic. 1 in 5 adults are HIV positive, 3,000 deaths out of HIV/AIDS per week, 80% unemployment, 25% of my girls are out of school. And sometimes a day hardly passes by without a girl reporting rape. Ladies and gentlemen, the list of challenges goes on as follows. In every development that a school has embarked on, they forgot to put a simple thing like a girl's incinerator where they can actually get rid of their sanitary towels, which are waste. When girls then spoil their dresses in school, boys jeer at them. When at one time in Zimbabwe, a man, a senior man for that matter, raped another man, it became big headlines in the news. But when a man raped a 3-year-old girl, that wasn't news. It came once in the newspaper. And it appears due to gender imbalance, we accept these imbalances. How can a man be reduced to a woman? That's why there was an outcry. But from the situation where I'm coming from, as a teacher, I saw it happening. And I really felt it coming. That unless we start challenging the systems that are currently in existence and come up with an activist development organization that supports and helps young girls to develop, there was going to be continuous gender imbalance in our society, and there is nothing that a man can do without a woman. Now, I'm not here to leave a negative picture about my country. I'm here to actually demonstrate that nothing is impossible. I'm one of the visionary activists that emerged a new breed of women. I'm only aged 32. Rape, for some time, it had been an issue swept under the carpet. Even as we returned from universities, empowered academically, educationally, and economically, as women, we felt it a no-go area to explore. Women's organizations, I should acknowledge a lot of work they did, but they forgot to address at an early stage issues affecting young girls and put them within the development framework. Our organization started with a negligible club in 1998. I was the teacher who saw the girls being jeered at. I was the teacher who was really moved when a male teacher said, "You see all these girls, they are my wives." Then I wondered, they were all under 15 years. How could they be his wives? Because he had simply had sex with them forcefully. That was a nightmare to me, and something had to be done. A network came into existence on 21 March 1999. And this became the first space that the Zimbabwean Girl Child Network got to really sit down with colleagues and mobilize each other internationally to look into issues affecting them as young girls growing up in a hostile environment. Amongst the challenges they were facing again, they are heads of families with no source of income, and sometimes they have to resort to commercial sex work. They are actually caregiving to their parents who have been in long illness. And also even at school, I noticed that they used to get to school very late, and not only in my school, even all these clubs that started sprouting in the country. Girls actually testified that it's not that we do not want to break into male-dominated fields, but we have got such limited time to study and concentrate on our books. I'm glad now to say we have got 100 girls' clubs in Zimbabwe. They are championing the causes of future women at an early stage. We did a 150-kilometer march over 15 days from Harare to Mutare, which gave us the platform to really define empowerment. And now empowerment to us as an organization means a process we have begun to instill, facilitate, and also provide the means of addressing social, political, and economic problems facing girls. And our strategies inform our programming. We have got the counseling department, specifically a girl without starting with herself, even an old woman like myself. Tell me to open up on what I did yesterday about sex. I start to shiver, but with young girls we are teaching them life survival skills which are critical to their growing up and them positioning themselves. We have also considered the welfare approach a young girl with 7 years cannot provide themselves. Ladies and gentlemen, education and training is pivotal to any girl's development. And that department has continued to train out students into international and national universities. And we have got 15 here in the United States. And that was a breakthrough when we are trying also to access resources to our country and knowledge. And our achievements are so many. We have got Girls Empowerment Village, which are now sources of information. Girls are actively involved in self-help projects and actually assisting their mothers. We have got women leaders who are role models who have come to the assistance of girls. And I should actually say, poverty to us is something which is not impossible. We have dealt with poverty from all the strategies of education, training, information and advocacy, where we try to address also issues on gender equality and also good governance. I will do justice to my short presentation if I end up with a quotation from a 9-year-old girl from rural Rusape. When she was asked why she was walking 10 kilometers to and from school in winter, barefooted, hungry, and half naked, she answered, "There is no club, girls' club, at a nearby school." And when we asked what Girl Child Network means to her, she said everything. And you can imagine at 9 years. And yes, she's prepared to struggle on. And I totally agree with this little girl that indeed there is a movement for girls. 10,000 girls who are members of Girl Child Network in Zimbabwe are a new breed of women walking in the fullness of their potential. And in honor, I just want to demonstrate a few pictures to show exactly what we have accomplished. Big smiles that we are bringing to them. You can see set as we begin. As we go along to empowering them, they really change faces, think about their problems, and also those are the women spearheading the campaigns, and you can see the early stage at which they are starting that. Ladies and gentlemen, a pleasant morning, and thank you for listening.
After these three remarkable presentations, it's now time to open up the session to questions and comments from the floor. We'll follow the same procedure that we used in the first session. Please raise your hand and one of the staff members will come to you with the microphone. I ask that you identify yourself and indicate to which speaker or speakers you wish to respond. Begin with the first question. And this really is to every member of the panel or any member of the panel who would like to address it. Maya Ajmera in her presentation mentioned five leading causes of childhood deaths in the developing world. And some of those are diseases that are vaccine preventable. And yet, currently in the United States, an enormous amount of attention is being paid to illnesses or potential illnesses that are not, in fact, killing very many people worldwide. SARS is an example. Another example is anthrax and the threat of bioterrorism. At the same time, one remembers the 1917 and 1919 influenza epidemic, so it's clear that diseases that are not killing extremely large numbers of people today can come out of nowhere and have enormous consequences worldwide. How are we to try to balance? How are the rich countries of the world to try to balance attention paid to terrible diseases that currently have a vast death toll versus the attention paid to perhaps extremely unlikely but nevertheless potentially devastating diseases?
Well, I think it's always a difficult assessment to make to balance that the scope of your activity as a country responding to another country's needs. So in terms of a government's response to another country's emerging epidemic. But I think that looking at, and I think coming up with a system of kind of prioritization or triaging has never been that, I think, justifiable or sustainable, and moves into an arena of a relatively arbitrary criteria that are used. And I gravitate much more to looking at those opportunities that present themselves, that are doable, that are responding to the worst of the need, but that partner with existing infrastructure within those countries to add and enhance the capability, as opposed to dropping in and responding in a satellite or isolated fashion to the problem. But it's hard for me to answer, I think, more specifically than that.
Thank you. I believe we have a question just here, please.
Well, that was fantastic from all three of you. But I had two questions, very quick, for particularly Maya and Betty. One is how to scale up. I think it's mostly for Maya, but what would it take, Betty, to go from 10,000 girl children to 100,000 or 1 million? Of course, it's money, but it's something else as well. And what's the potential? And then for Maya, do you have, it was just fantastic to hear about these different groups you're supporting. Could you be helped, or do you have a system that would make public to everyone here and to the millions of Americans who would dig into their pockets to help? Something like a good housekeeping seal of approval for the thousands and thousands of initiatives, the local infrastructure that Eric referred to. How could we do that, and do you have it already? How do you decide which of these groups to support?
Thank you. For my question, do you mind repeating because of the accent? I think I missed the figures and everything, so that I answer you more appropriately.
What would it take to go from 10,000 members of your clubs to 100,000 girls? Is it just money? How do we clone Betty Makoni?
Obviously, it takes money, not the vision and the passion. Apparently, officially, we have got 10,000 members. But I know with little girls, with how excited at the moment they are about their movement. So many girls, informally, they've set up their own clubs. So one, I would say it takes us, the visionary leaders, in terms of passion, to expand more. But human as we are overstrained, and not everybody shares the same vision. So automatically it means we need more staff members to come in. We even need to groom other young girls who pass through the network to go and set up clubs. And definitely I should confirm to you, our membership should be more than 10,000, but formally we are only able to deal with 10,000 because those are the girls we can monitor and share results about and evaluate in terms of progress and whether there are any indicators of empowerment over a period of time.
Just to answer the scale question, and then to the other piece of how do we get the knowledge out there to people who are interested in the extraordinary groups out there. I look at scale in two ways. One is either you're in a community and you go very deep and you try to reach as many children as possible, or you scale out. So you want to, if you take the trained platform schools, perhaps you could imagine having trained platform schools in every station in India. And scale can, when you scale out in that perspective, I think governments can play a very important role in the scaling piece. And I mentioned in my talk about Ethiopia taking on a non-formal program that Save the Children Alliance had developed, and they're going to use it through the formal system. The second piece to your question about the good, sort of, how do you get the knowledge out there? Right now, at least on our website, we have all of our partners listed with their email addresses, with the name of the executive director. It's very transparent. Anyone here can go and communicate with our partners anywhere in the world. The other piece that you're talking about, the good, sort of the seal, is something after 5 years, is something we as an organization and our board is going to have to consider as we fund more and more groups out there in the world. And perhaps that's something you and I can talk about.
Thank you. We have a question just here.
Thank you. Betty, you know what I might do is just hold it myself if I could. Thanks. Because I'm so tall. Betty, your passion and your creativity is boundless, and you're a remarkable teacher. I wonder if you would share with the group this morning the story that you told me last night about how you use theater with the girls to convey some of the issues and the things that are happening in their lives.
Thank you very much. Yesterday I talked to my good gentleman about how we employ theater for development. When children want to speak to us, the most difficult thing they have is to open up that easily. When they begin to play, imitate characters, and make their own plays about their own situation, we get down to the situation to think really what prompted a child to start thinking about a man who rapes, and community being aware of the fact that such and such a character exists here. This is how we have managed to get up to 300 men per year and have them sentenced to a maximum of 15 years in jail for sexually abusing children. Because by the minute a child acts out somebody, we don't stop there. We want to explore further. What then did you do to you? Then you hear them saying, not to me, but to my friend. That's why I've been sensitized to do this play. And communities are now coming out strongly to listen to children sing, to listen to children do poetry and drama, to actually listen and engage themselves in each play that a child comes up with. And we have got samples and samples. And somebody has been talking about maybe televisions. We don't need them, because that situation in our part of the area is televised in itself. The children have got their power to portray what's happening to them. And that's basically what they need as a medium of communication to issues affecting them. So that's how I can best explain how theater is assisting in development work. And myself being the first grassroots theater practitioner in the country, well, give me 15 minutes, I need a crowd of 15,000, it doesn't take me time, and it has really happened.
There's a question, yes.
Bankar Roy from the Barefoot College in Rajasthan, India. In 1975, we did a survey of children who never went to school, and we found that about 70% of the children don't go to school in India because they've got better things to do. They look after their cattle, they look after their sheep, they look after their family in the morning, so they only have time in the evening. So in 1975, we started the first night schools of Thilonia, where children who looked after cattle in the morning and sheep and goats came to school at night. Over the last 20 years, we have started about 150 night schools, where 3,000 children, boys and girls, come. But the beauty of these schools are that every 2 years, we have an election. And 3,000 children vote in a prime minister. The prime minister today is 12 years old. She looks after goats in the morning, but she's prime minister in the evening. She has a cabinet of Minister for Education, Minister for Environment, Minister for Home. And if the prime minister should write a postcard to me saying that this teacher is not working, he or she is fired. So it's a very serious business, this cabinet that she has. She has the power to monitor, supervise, and administer 150 schools with a cabinet of 12 to 15 or 14-year-old boys and girls. We've had 3 elections over the last 7 years. All of them have been girls, and they've had tremendous presence to control and discipline the adults. If a night school doesn't have a solar lantern, if a night school doesn't have teaching aids, if a night school doesn't have learning aids, then the Minister of Education, who's 12 years old, writes to me and says, look, this school where we are working doesn't have teaching aid or doesn't have learning aid. What are you doing about it? So our organization, the Barefoot College, has to respond to this parliament of children who actually have the rights to be able to control their own school, supervise their own school. We like to think that we have a very different definition of a professional. What is a professional? A professional is someone who has the competence, confidence, and belief, and that is combination we call in the rural areas a professional. So we call a traditional midwife a professional. She's very good. Half our members of parliament are still alive today, God forbid. They still are very, very good. They have the technology and the skills to do this. So we like to think that innovation and solutions start from the community. It cannot come from the top. Thank you.
I wonder if a member of the panel would like to comment or respond to those remarks.
The issue of shared vision, I think he should have overemphasized that. Of course, much as we want our children, I've got an example myself. Our children are in girls' clubs and they are led by teachers, rural school teachers. If that rural school teacher herself is being beaten up by her husband, sexually abused herself, is not empowered to actually spearhead such a campaign. Sometimes you see even children emulating whatever is going around them, because children learn fast from things that are around them. So we would encourage also visionaries to come also from, because once at one time in our lives we were once children. We know what children want. We know, most of us have gone through rape. We know what rape is. We know actually how to bring out feelings to our children, and we know how together with them, you know, champion anything that is of paramount importance to them. So I would not underestimate the strengths of adults who missed it out, and yet they still have that important chance to learn and come back to their own children and do something about it. And I think I'm one good example of that.
I'm just going to say hallelujah. It's wonderful. They do wonderful work, and the whole concept of non-formal education and getting kids to go to school in the evenings, it's not only happening in Rajasthan, but in many, many places in the world, and it's quite effective.
All the way to my left.
Hi, I'm Jerry Sarnett. I'm a Stanford physician who runs a local homeless clinic. I just read in the New England Journal that the estimated costs for just drug therapy alone in the United States, adding new fusion inhibitors, will be well over $30,000 a year. My question is for Dr. Goosby to start. Last year, we were given a context for the strategic allocation of dollars, where you would start first, where you get the most bang for your buck in sub-Saharan Africa. And I would appreciate your updating us from last year's conference on how best to use President Bush's and others' allocations.
Oh, thank you. I think that looking for the durable opportunity is really the key. And what I mean by that is looking for those opportunities that allow you to enter a community, preferably through a government, and I'll explain why that in a second, to identify individuals that are already there and connected with the medical community who can be trained through didactic, but mostly, as I was alluding to in my brief talk, mentoring relationships that put systems of care in place on a referral and consultative basis at the same moment you expand the medical treatment capability. So doing the didactic lecture results in very little change in practice patterns to an individual. You go in, give us AIDS 101, OI, STI treatment, and leave, and look at what that person does who was trained, and their behavior changes very little. But if you go in and put a referral capability in place, in your didactic lectures use physicians and experts who are in country and of country to give those portions of the didactic curriculum. You fill in the areas that there is not expertise in. It creates a network of collegiality and enhances relationships that are already in place. The reason that the government is important is because NGOs are frequently the best interfaced with the affected population and are a critical component to enter and partner with. Often the only component, especially when the government is not receptive. I want to say that first. But when you have a receptive government, you are there in that relationship and partnering with the government. You are partnering with an entity that has a mandate to treat everybody. When you partner with an NGO, it's limited in terms of their scope. It's a catchment area, understandably. When you partner with a university, there's also a competing research and training mandate that precede, if there is a mandate to treat everybody. We've learned the hard way by going in and partnering just with NGOs, just with universities, and kind of hitting a wall eventually when we're trying to, as people were talking about in another context, scale up. If you are going to have an opportunity to scale up through that entry, it is best to try to dialogue and partner with the government as at early a point as you can because of that larger ability to address the larger population.
I believe there's a question to my right.
Yes, my name is Jeff Burton. I wanted to ask Betty a follow-up question that's keyed off of a very interesting and I think valid point that Maya made, and that is, are there corollary boys' clubs in Zimbabwe that might assist somehow or another or be in conjunction with the girls' clubs? And if not, what are the barriers? Are there social or cultural barriers that keep boys' clubs from being formed?
Quite a good question. When the girls were beginning their movement, a lot of men started crying foul. Is it 1 + 1 is equals to 2, or 1 + 1 sometimes equals to 3? We are looking at a car traveling at 20 miles an hour and one which is traveling at 100 miles an hour. And we thought to ourselves, in order for these cars to go at the same, at the same speed, we simply need to do something about the other car which is moving slowly. If you look at the lives of girls in the African context, a boy, that's why I introduced myself and said, look at names like Tawanda, the appreciation we automatically have when we have boys, even before they are born. A man would rather celebrate first when he knows that the scan says it's a boy, because they know their name. So inherently in our community, and also patriarchy tells us that for the boys, with all the football matches, the heroes on television, parliament with 150 men compared to, 13 women, and also our government with 3 male presidents, our young boys have got so many role models to take it from. So we take it that they are already cultural and modern institutions put in place to automatically tell the boys that, look, you are the men. You actually look at the family. But if you look at our cause, we recognize their important role in trying to bring, development to the girls. But we don't always take it that if you've got a girls' club here, automatically have a boys' club, so that it is 1:1. Because already they are at an advantage compared to whatever situation is existing. And if you look at a situation where, when children's organizations started, street children's organizations, the people who went there for shelter mostly were boys. And also, if you look at the number of boys currently in university, which is an institution, by the time the girl finishes secondary school, already she has dropped down, she is nowhere to be found, she is married, and what have you. But if you look at the number of boys at higher learning institutions, and all these male-dominated fields they have taken up, it gives us every reason not really to concentrate on their advancement, but also to push the 20 miles per hour car and make sure that it travels at the same speed. Because at the end of the day, we want them to get to the same destination. So I should take it and answer you briefly and say, yes, there are boys' organization, and specifically in Zimbabwe, there is one called Padare with a youth forum. And every organization where there are males and females, they've created a youth forum. And that can actually take charge of the young boys. But we do not say we don't want to see them. They are free to form their boys' organization if there is justification enough, to advance gender equality on their part. But this time, they are behind us, and we are leading.
Question here in the back.
I have to hold it. Thank you very much. My name is Fidelis Ume. I am the chairman of ASEDO, which is Africa Directed Philanthropic Organization. My question is for Eric Goosby. The issue on HIV in sub-Saharan Africa, what we hear is mostly the crisis areas. My question is, what efforts are being made to capture information, quantify information, and try to arrest the growth of AIDS, the spread of AIDS in the other countries of sub-Saharan Africa that do not currently have visibility on the World Forum? Because I think that that's a form of prevention that is just as essential as a prevention effort within a country. Thank you.
I think that the needs of all the countries in sub-Saharan Africa, both in the prevention and treatment arena for HIV, are growing in the world awareness, as well as growing in the local political awareness. I think that the pattern that I've seen over the last 20 years with HIV and a willingness to respond in a substantive way to it in any country or in any community has come through the realization of the local community, civil society, and leadership that this is indeed a problem that is impacting us and is our problem that we must take on as our problem to solve. When institutions or entities try to come in from outside and impose a response, it flurries for 2, 3, 5 years, but never engages in, I think, and integrate itself into the civil society that indeed must pick up that baton and run with it. So efforts that opportunities that are identified where there is a political will, even if it's a local political will, even if it's just in a village or just in a portion of a village, need to be looked for, identified, nurtured, and amplified to play the role that they are trying to play. I think as if you are throwing a series of pebbles into a stagnant pond, all of those concentric circles that are created and go outward, eventually intersect with each other, and eventually hit the shore. And I think that that idea of starting small and moving to large is really the only way to go in many systems, in many political systems that are not responsive to or have prioritized HIV as the problem that it is.
We're almost out of time. I believe there are two people that have been waiting to ask their questions, and I'm going to ask each of them to, in succession, to ask their questions succinctly, and then the panel can decide how to respond. Please.
Stuart Burden from Levi Strauss and the Levi Strauss Foundation. And my question is an attempt to link some issues from the last plenary and also some issues that I see coming up in the next plenary. As we talk about perhaps science and its contribution to development, we've been talking about HIV/AIDS. And in the last plenary, we were talking about leveraging government support. And I guess I would like, Eric, if you could perhaps start, and the other panelists could join, and provide an assessment of your current thinking about the debate around HIV/AIDS drugs, picking up on the gentleman's question, especially about the patent-protected drugs and their distribution in the developing world. Brazil was held up as an example of a country that has responded, but they took a very bold and risky step in copying in their own laboratories on generic copies of drugs, some of which I believe were still patented. And now there's the question that even countries might distribute those drugs. And so as grant makers, we're in an awkward position because we are hearing from many of those NGOs that want to push governments to do more of this, but of course there are some ethical and legal issues, and I appreciate your perspective.
Eric, before you reply, let me just also take the last question, and then the panel will just have a couple minutes.
Hello, my name is Caroline Hartnell from Alliance Magazine. My question is not unrelated to the last one. It's really just something been alluded to, is the policy level and advocacy, and sort of the other aspect of scaling up. So just what's needed, for instance, or do the panelists see it as part of their work to look, for instance, not just from getting from 10,000 girls network to 100,000, but to engage with local governments and national governments and even international networks to push for the rights of girls to be not abused, to have education, to have the same rights? And is it a specifically good role for funders and people from outside to help enable them, organisations to network and join up with others engaged in the same issues? Thank you.
Thanks. I have to ask members of the panel to be very succinct in your replies.
I'll take the second question just very quickly about the whole idea. When we fund NGOs, one of the things that we look for is not only the impact that they're having on the social innovation and education, but also the leaders' impact that they can have on policy at the municipal, state, national, or even global level. And we're starting to see that with several of our partners that are actually doing both. Their mission is two-pronged, that they're not only doing direct service, but they're also really doing advocacy and policy work.
Yeah, I must be frank and say all is not well from my side in terms of when there is political violence, there are political misunderstanding between men and men. Who suffers most are the children and women. And at the moment, donors are shunning our country. Some have pulled out at a critical time when people need them most, when we are facing an almost genocide on innocent people, poor for that matter. So I would say our government approved a plan to have drugs in the country, no problem with that. But as to get international people who are forthcoming, because I think the misunderstanding have led people to punish the poor more than the rich. So I would actually say even with the young girls who are getting sexual abuse and infected by HIV, I know the virus can be contained through certain drugs, but I'm watching helplessly girls in grief, dying on a daily basis, and sometimes when they start all these illnesses, nobody's there to actually care for them. So I can say from my country, the situation is a bit critical, and we would put it under emergency to have lives saved, and not lives of the rich, but lives of the poor people, especially in the rural areas. And I can actually say, yes, we used it to be a small network, to the second question, but now we are fast, connecting regionally in Southern Africa to become a girls' real movement. Because if you look at issues on rape and HIV/AIDS, that can undermine the development of all future women if all get infected and they die. And you can imagine the youngest sexually abused child in Southern Africa is only 6 months. So you can imagine this big man of mine here sexually abusing a 6-month-old baby. And this whole myth that, HIV/AIDS can be cured through virgins and other things we really need to seriously start working on are all challenges that are confronting us. And information and advocacy, the program we developed ourselves, is going to awaken the international community also to really consider our situation and come to our rescue, because we can actually save lives. There is, potential in Zimbabwe to revive the country and to really save potential leaders for tomorrow. So that's what I can say on Zimbabwe and Girl Child Network particularly.
Eric, a final brief word?
Sure. I think that the issue of generic drugs versus the branded drugs is a complex one, but I think it is very reasonable. Brazil's approach by creating generic manufacturing within their country to develop drugs, going on the TRIPS agreement and the WTO agreement that if your country is burdened by a medical problem for which you cannot afford the medications, it is legal now for you to decide as a country that you are going to go down a generic route and not be penalized for that. The problems from a clinician's point of view with going with generic drugs is a real one. If you practice long enough, you see problems emerge, some mostly small but some big, with generic formulations. A methyl group change on a molecule can change its side effect profile potentially. And for those types of fears, the preference is really to go with the drug in which the research was done, in which the efficacy was shown and demonstrated. That having been said, and I think the pharmaceutical companies deserve to be interfaced with around the costs of the drug, the medication, before you go to the generic manufacturer and say that we are indeed going to purchase generic drugs because we can treat thousands more. And most pharmaceutical companies, and Pangaea's experience, have been receptive to talking about lowering their prices to an acceptable level or even to a comparable level to the generic. So it's a complicated dialogue. It's one that I think you should engage with pharmaceuticals companies in initially, but if not, I think you, on an ethical level, need to turn to the generic formulation.
Thank you. On behalf of the Global Philanthropy Forum, I'd like to thank Maya, Eric, and Betty for sharing their experiences with us this morning.